My name is Tab Beverly. I'm a licensed insurance professional. I've been in the industry for over 23 years, and I've been in almost every area of this business, from sales to service, contract negotiations. I've had the opportunity to teach and manage other agents and service people. I've been involved with billing and collections, and as a resident professional here, I'm actually accessible for the public, 9 to 5. You can chat with me. I'll answer your questions, your concerns. I'll help you make a right decision that you may be confused about in the marketplace today.
My name is Ben Barson. I'm a licensed insurance agent. I work here to help people understand the benefits of health insurance. I work with individuals and families across the entire country explaining the differences of plans that are available to them that they may or may not be aware of, what the benefits are, how it will help them protect their income, their assets, their wealth, their family, their house. I go and work with some of the top carriers in the country. I help agents in the office go through different plans and benefits that are available with other clients to work with them and help them find the best plan available to meet their particular health coverage needs.
Tab and Ben, prior to shopping around for health insurance, what are the most important questions that consumers should think about?
It's a great question, and one of the things that every person out there should consider, because this is a big decision. It costs a lot of money, and nobody likes surprises. So the best thing to do is really be prepared prior to making telephone calls. When you call an agency, make some lists. Write some things down. Write your information down. Your heights and weights of you and your family members, if you've got family coverage. Names of medications that you're taking. Conditions. A lot of people don't realize how important it is to not only put dates down, but the names of the conditions they have and the treatment, whether they're still ongoing or if they're fully recovered. The names of their doctors and telephone numbers are also important. We should also advise the client to have a good understanding of what type of coverage that they want. Basic coverage as far as a PPO plan and/or options. They should really know what options they want. So when they do get a licensed professional agent on, they can actually tell that agent what they want, and then that agent can steer, after collecting all the information, steer that person to the correct type of coverage.
Yeah, a person should always think about evaluating their current situation with their annual spendings, what they spend per year on their own private health care. I mean, people need to take into consideration how much do they spend each month or each year to cover their cost of their medications or going to see a doctor, or how many times in their life have they been hospitalized, to factor in that cost versus the cost on what it's going to take to cover your monthly premium. Sometimes the premiums outweigh your annual cost, so you got to keep in mind you're going to be paying for something per month. Is that cost higher than what you're spending per year just to cover your health care expenses? It has to be an equal balance there, and that's why we try and help the clients understand what it's going to cover and what it's going to cost.
One of the major other areas that you should be concerned about is, as you start a conversation with an agent, if you're not comfortable with some of the terminology, start jotting down some things that you're not comfortable with, and make sure you ask that agent to explain. There can be many different definitions to different types of phrases. This is an industry that it's almost as bad as the legal world. I mean, people don't understand the verbiage in this industry, and it can be confusing. So make sure that the person understands what each person is talking about. The other thing that I would tell you that would be very important to desire is, we all want to know whether or not your doctor is in the network, the hospital, and just how easy this is going to be to access with the decisions that you make.